1. The client with diabetes is preparing for discharge. During discharge teaching, the nurse assesses the client's ability to care for himself. Which statement made by the client would indicate a need for follow-up after discharge? A. I live by myself. B. I have trouble seeing. C. I have a cat in the house with me. D. I usually drive myself to the doctor. The correct answer is B. I have trouble seeing. 2. The physician has ordered the Schilling test for a patient with suspected pernicious anemia. What other vitamin level is often assessed at the same time as the B12 level? A. Folic acid. B. Pyridoxine. C. Ascorbic acid. D. Thiamine. The correct answer is A. Folic acid. 3. The nurse notes variable decelerations on the fetal monitor strip. The most appropriate initial action would be to A. Notify the physician. B. Increase the rate of IV fluid. C. Reposition the client. D. Readjust the monitor. The correct answer is C. Reposition the client. 4. The nurse is providing dietary instructions to the mother of a 4-year-old diagnosed with celiac disease. Which food, if selected by the mother, would indicate her understanding of the dietary instructions? A. Wheat toast. B. Spaghetti. C. Oatmeal. D. Rice. The correct answer is D. Rice. 5. The home health nurse is planning for the day's visits. Which client should be seen first? A. The client with renal insufficiency. B. The client with Alzheimer's disease. C. The client with diabetes who has a decubitus ulcer. D. The client with multiple sclerosis who is being treated with IV cortisone. The correct answer is D. The client with multiple sclerosis who is being treated with IV cortisone. 6. Which information should be given to the patient undergoing radiation therapy for breast cancer? A. Avoid exposing radiation areas to sunlight during treatment time and for a year after completion of therapy. B. Moisturize the radiation site with oil-based lotion to prevent blistering. C. Use bath oil when tub bathing to prevent drying and peeling. D. Report redness and soreness of the area to the physician. The correct answer is A. Avoid exposing radiation areas to sunlight during treatment time and for a year after completion of therapy. 7. A client being treated with Coumadin, sodium warfarin, has an INR of 8.0. Which intervention is appropriate based on the INR level? A. Assessing for signs of bleeding. B. Administering intranasal DDAVP. C. Administering an injection of protamine sulfate. D. Limiting the intake of foods rich in vitamin K. The correct answer is A. Assessing for signs of bleeding. 8. A client is scheduled for surgery in the morning. Which of the following is the primary preoperative responsibility of the nurse? A. Making sure the vital signs are recorded. B. Obtaining a signed permit for surgery. C. Explaining the surgical procedure. D. Answering questions about the surgery. The correct answer is A. Making sure the vital signs are recorded. 9. The nurse is performing discharge teaching on a client with diverticulitis who has been placed on a low-roughage diet. Which food would have to be eliminated from this client's diet? A. Roasted chicken. B. Noodles. C. Cooked broccoli. D. Custard. The correct answer is C. Cooked broccoli. 10. A 25-year-old client arrives in the emergency room with a possible fracture of the right femur. The nurse should anticipate an order for A. Bryant's traction. B. Ice to the entire extremity. C. Buck's traction. D. An abduction pillow. The correct answer is C. Buck's traction. 11. Which of the following would be most appropriate for the nurse to wear when providing direct care to a client with influenza? A. Mask. B. Gown. C. Gloves. D. Goggles. The correct answer is A. Mask. 12. Which of the following assessment findings is consistent with an extracellular fluid volume deficit? A. Hyperglycemia. B. Oliguria. C. Bradycardia. D. Hypertension. The correct answer is B. Oliguria. 13. A home health nurse is making preparations for morning visits. Which one of the following clients should the nurse visit first? A. A client with a stroke with tube feedings. B. A client with a history of congestive heart failure complaining of nighttime dyspnea. C. A client with a thoracotomy 6 months ago. D. A client with Parkinson's disease. The correct answer is B. A client with a history of congestive heart failure complaining of nighttime dyspnea. 14. The nurse has just received the change of shift report. Which client should the nurse assess first? A. A client 2 hours post-lobectomy with 150 ml of chest drainage. B. A client 2 days post-gastrectomy with scant drainage. C. A client with pneumonia with an oral temperature of 102 degrees Fahrenheit. D. A client with a fractured hip and buccal traction. The correct answer is A. A client 2 hours post-lobectomy with 150 ml of chest drainage. 15. The nurse is making assignments for the day. Which client should be assigned to the pregnant nurse? A. The client receiving linear accelerator radiation therapy for lung cancer. B. The client with irradium implant for cervical cancer. C. The client who has just been administered soluble brachytherapy for thyroid cancer. D. The client who returned from placement of iridium seeds for prostate cancer. The correct answer is A. The client receiving linear accelerator radiation therapy for lung cancer. 16. The palliative care nurse is caring for a client with advanced multiple myeloma. Which intervention is most appropriate? A. Monitor blood work for hypocalcemia. B. Maintain fluid intake at 1 liter per day. C. Use gentle repositioning techniques. D. Limit administration of opioid medications. The correct answer is C. Use gentle repositioning techniques. 17. A patient receiving chemotherapy is experiencing stomatitis. Which of the following should the healthcare provider offer the patient? A. Vigorous oral care with a commercial mouthwash. B. Plenty of ice chips between meals. C. Warm saline rinses 4 times each day. D. Hot soup for lunch and dinner. The correct answer is C. Warm saline rinses 4 times each day. 18. A 10-year-old boy is admitted to the pediatric unit with a diagnosis of viral meningitis. He is experiencing a severe headache, a stiff neck, vomiting, photophobia, and drowsiness. The nurse can make him more comfortable by A. Teaching him deep breathing. B. Encouraging him to drink fluids. C. Closing the shades and dimming the lights. D. Providing him with a large soft pillow. The correct answer is C. Closing the shades and dimming the lights. 19. A patient with a diagnosis of lung cancer is receiving chemotherapy. The patient reports nausea and loss of appetite, resulting in decreased food intake. What should the healthcare provider recommend to the patient to promote adequate nutrition? A. Eat small meals throughout the day. B. Eat only favorite foods to increase appetite. C. Eat large meals, but less frequently throughout the day. D. Eat only when feeling hungry. The correct answer is A. Eat small meals throughout the day. 20. A patient with a total hip replacement requires certain equipment for recovery. Which of the following will assist the patient with activities of daily living? A DL? A. TENS unit. B. Abduction pillow. C. Recliner. D. High seat commode. The correct answer is D. High seat commode.